Hello, everybody. Good to see you again. So today we'll be talking about diabetes with amazing diabetes educator Mel. Okay, so let me introduce myself. My name is Ange, or Anjali if you like to call me. I'm health and wellness coach, women's health. Okay, and I just added nutrition counseling as well, and of course I'm the founder of this page. Okay, so I think Mel is going to try to come live. So now let's get to know Mel to another level. Okay, so I'm going to read her bio and try not to look at the paper as much, but yes, Mel is coming. Okay, of things she has achieved in her life. All right, so Mel, maybe you want to try again. I didn't get to accept you for some reason. Oh, here she is. Welcome, Mel. Thank you so much for being here again. Yeah. Can you hear
I
me?
can. Yes, can you hear me?
Okay. Yes, I can. And so I'm going to read your bio. Okay. So Mel and I was saying that how many things you have achieved. So I'm going to run out of my puff. Okay. So you have a Bachelor of Nursing and Postgraduate Certificate in Diabetes Education. You have worked as a clinical nurse specialist and credentialed, is that how I say it? Yeah, diabetes educator for more than 15 years in the Northern Territory, Victoria, Queensland, and New South Wales, including, do I say FIFO or FIFO?
I think FIFO, fly in, fly out,
Oh,
I used to do.
okay. Yeah, FIFO, hospital and community-based roles. Melissa has a passion for education and health literacy and supporting self-management alongside a chronic health condition. So she has experience collaborating with individuals with type 1 diabetes, type 2 diabetes, gestational diabetes, and diabetes technologies such as continuous glucose monitoring and insulin pump therapy. The youngest individual she has supported. Hello, sorry, I was so into reading and I didn't even say thank you so much, everyone, for coming. You're welcome. And if you can hear us, please give us a thumbs up. Okay, I'm reading Mel's amazing bio here. Okay, so I can't. Yes, 2 years, right? So 2 years old, right through to an amazing 98 years old. So you are a lecturer in Southern Cross University, Gold Coast campus for the postgraduate certificate in diabetes education program, and you enjoy health professional education in community workforce, also NDIS support services or schools. Thank you, everyone, for coming. Health literacy and education is a passion. And you are trauma-informed specialist with experience supporting individuals age 3+ with medical trauma, anxiety, complex trauma, ASD, ADHD, alongside chronic health condition management. I'm saying, how do you do it? I'm asking. Yeah, it's incredible. Yes, and you're a mom of 2 boys, right?
One
And
boy. Yeah,
sorry,
one girl
two,
and one boy.
2 little people. Okay. Thank you for correcting me. And you are doing AFL. You have joined AFL team this year.
I've started playing AFL, yes, with the Surfers Paradise Masters. So we're all over 35, just getting out there, moving our bodies and learning about footy. So
Amazing. Yes. So that is incredible. Like coming to our age when you do something, you join into something new is like so empowering.
yeah, it's been great. Like physically, it's been obviously moving your body is great, but mentally,
Yes.
it's been really well just to get out there and meet some new people and have a bit of fun.
That's amazing. Yes. So you're inspiring us to join something new that you wouldn't think to do or join, right? So thank you. So Yeah, before we start, I just wanted to mention to our viewers or whoever is watching the recorded live later on, is that this talk is all about to bring awareness, educational, and information on diabetes. This is not a specific diagnostic for you, just to empower you with the information and give you a general idea. And if you are if you're looking for help, please find the closest practitioners closer to you. Or you can later on stay here and ask questions to Mel at the end. We have Q&A session. And yes, and I think we should jump right in. Hey, Mel?
Sure thing.
Yes. So please, if the people like myself who are not that educated around diabetes, what is diabetes? And I have heard there are different types. So would you be able to tell us about that, please?
Sure. So diabetes is a condition where the body's not able to access the glucose that we get from our food, our carbohydrate foods, into the muscles where it's stored as energy. So if you think about you and I, we don't have diabetes, but when we have say we've had some Wheat Bix and a milk and a coffee for brekkie, there's some carbohydrates in that food. So our body's really great. The tummy breaks down those carbohydrate foods and it turns into glucose. I try not sugar because a lot of people think of, we say blood sugar, it's another term related to diabetes, but a lot of people tend to think of sugar as lollies and chocolate and Coke.
Yes,
so
that is what I thought to start with. Yes,
so
lots of lollies. Yes.
Carbohydrates are our energy food. They're great for our brain. They're great for our body. That's where we get our petrol from, our energy.
Yes.
So our tummy mashes that glucose up, and that glucose passes into the bloodstream where it has to circulate around the body, but it also needs to get into our muscles as our petrol tank. And the only way it can get in there is with the help of the pancreas. So the pancreas is an organ inside the tummy that makes it. So insulin is the only thing that can carry that glucose into the muscles for our energy. So there are a few different types of diabetes, as you've mentioned. So type 1 diabetes, it's less common. It is where the pancreas is not making any insulin. So there's no cause there's no cause for type 1 diabetes. There's theories around environmental and viral and genetics and things like that, but there's nothing really that we can blame. But there's some amazing research happening all around with regards to type 1 diabetes. But the pancreas is just not making insulin. It's the little beta cell destroyed because of an autoimmune process, and people need it to survive. So that's where they might need 4 or 5 or 6 injections a day to help that energy. Type 2 diabetes, the pancreas is still making insulin, just not enough. And there's a combination of genetics and risk factors, such as, like, if you've got a big family history, you've got a pretty good chance of getting it. I think the stats are around, if you've got one parent with type 2 diabetes, you're around about a 50% chance of getting it. So the pancreas is making insulin, it's just not making enough. So that energy can be in the blood. So when people are doing those finger pricks, or they might be wearing a sensor, much glucose floating around in the body. And I got gestational diabetes this week as well. So that's diabetes in pregnancy. So the placenta is so amazing at making all those pregnancy hormones, but that can cause resistance. So that's managed with good food and exercise and medication as well. So they're probably the most common ones that people would know of. There are a few other types, but I won't go into those ones today. But if anyone has any questions.
So so type 1 is from the autoimmune, so just to rephrase it, and then type 2 can be genetics. Is that
or lifestyle? Yeah,
and then gestational diabetes is for the pregnancy ladies, right?
Yeah, so that can occur, because of the placenta's making all those amazing hormones, so it just causes that insulin. Yeah.
Okay, awesome. So we got the 3 types of diabetes we just learned. And there's more, but yes, we're just talking about 3 today. So as we're talking about, our platform is women's health, platform. So I just wanted to hear what you have to say about the gender affected, if any gender affected more than the other one, or what is the relation in male and female? How does it affect?
So I think in Australia, there's about 1.5 million people registered as having diabetes. There's it's probably about 50-50 looking at the latest stats I've had a look at. In the hospital that I work in, I generally would probably see more males with diabetes, but there's a lovely female, a wife or partner in the background that is definitely impacted by that diabetes, whether it's helping with that person look after, whether
Yes.
health support, the medication aspect of it, on insulin and perhaps having lots of hypos, or if there's other long-term conditions with regards to foot care or heart or eyes and things like that. So women are impacted differently. It's still about a 50-50
Yes.
diagnosis, but
Yeah.
in the world, I guess, where I'm working, I do tend to see, men and women affected differently by diabetes, definitely. Yeah.
Yeah. Awesome. Thank you for that. So we know, roughly where we stand. And thank you for that. And so I didn't write the question here, but I just wanted to say, so is there a leading, what leads up to, I think you already mentioned a little bit, touched on that, three types of diabetes, that what leads to the diabetic situation in our body? Just
So it's a little bit different between type 1 and type 2, but basically, in a nutshell, if there's too much glucose floating around in the body, it can't get into the muscle because there's not enough insulin or no insulin. People can experience some symptoms. So people can get very thirsty. Their body's very rid of that glucose out of the blood. So if people are very thirsty, they're trying to flush that out. They're then weeing a lot, toilet a lot.
yes.
Polyuria or polydipsia are the medical terms. Some people are very, very tired. They've just got no energy. So a lot of people leading up to a diagnosis of, say, type 2 diabetes, for example, it's a lot slower compared to type 1 diabetes. So type 2, they're still making insulin, but not enough. So they're tired, they're thirsty. Some people can get a bit angry. Some people can get blurred vision. That glucose can get into the areas of the eyes on its own. It can change the shape of the lens of the eye, which can then impact vision. But for saying that, some people don't get any symptoms at all. So there's a lot of people around in the community that might have diabetes but not have those really common symptoms.
Yes. Yeah. Yesterday, when we were talking with Helena, that we had another guest live, and she said that people might not have any symptoms at all. So I think that's why with the gestational diabetes, we have to do the sugar test.
Yeah.
When we are pregnant. Yes. That was very interesting.
Being pregnant, you're tired, you're thirsty, you're going to the toilet a lot anyway, which are those.
Yes. So it's like you already have the symptoms and you don't know how to
Correct.
separate that, right? Yes.
Type 1
So
faster, so there's no insulin being produced, so people can have those symptoms very, very, they can be very tired. Losing weight is another very common, because the body's hard to keep that energy, so it's looking for anywhere. So people with type 1 diabetes can have that very quick onset with thirst, tiredness, weight loss, and obviously levels and ketones as well.
Yeah. So my friend's son just diagnosed with type 2, I think. So I'm not too sure type 1 or type 2, but he was losing weight a lot. So and he got in ICU because they didn't know what was happening. But yeah, you wouldn't realize that it can be so severe, right?
Yeah, it can be very, very quick, and people can become very unwell very quickly with a new type.
Yeah. Yes, that's
but it fixes everything really quickly. So people that are diagnosed with type 1, once they get that insulin, they feel better very quickly. Yeah.
Oh, that's it's incredible. My grandfather had diabetes, right? But he wasn't allowed to eat rice because rice is our staple food. Potatoes, likewise, staple food. But poor thing, he wasn't allowed to eat any of those things. And it was just watching him was very torture. It's like a torture, everyone is enjoying because we eat rice and potatoes for every meal, like lunch and dinner, and it was very sad for him. But that is why we are so privileged here that we have the resources and we have the all the practitioners or the educator yourself that we're here to help. But in back home in Nepal, there's we don't have those kind of services or resources.
Yeah.
So all you do is just cut out the food and
Yeah.
carbs totally, and then you think you're okay.
Yeah.
But then yeah.
We
But
need those
anyway,
the energy. And you're right. Food is medicine. Good food is good medicine, and we can have all those chocolates and lollies and things like that in moderation. But food is not just about giving our body nutrition, but it's enjoying the access, the coming together, special occasions. So yeah, food and diabetes is another topic in itself. So it's really important to access
yes,
a dietitian that is aware of diabetes and management and carbohydrates and all those sort of things, which they all.
yes, yeah. So you just touched on the next step that I wanted to go to, the management steps. What does the management steps looks like?
So I'll touch on type 2 diabetes first. So with diabetes, we're still making a little bit of insulin. So the first things that people or the GP or who might recommend is good food and moving your body. So good food is obviously going to impact the levels.
Yes.
Moving your exercise is great for our muscles. Our muscles become a lot more sensitive to the insulin when we do exercise. So there's little doors on the muscles that can let the insulin carry that glucose
Yes.
in a lot. So, and exercise is great because it's obviously great for our diabetes, but it's great for our brain, our mental health, our heart health, all of that sort of stuff. We keep
Yeah.
strong. As people progress with diabetes, or they age, we want people to be strong because that's where we can reduce risks of falls and muscle wastage and that sort of thing. Generally, after that, there's tablets. So when I started doing diabetes 100 years ago, there was about 3 or 4 tablets on the market.
Yeah.
Now there's a whole big, which is amazing because lots of different people's diabetes. Diabetes is very individualized. So if someone's got some problems or some heart problems, some medications are not so great, or others. So people progress through the tablets. Type 2 diabetes is progressive. It's a bit trickier to look after the longer that you have it. Once that maximum amount of tablets that they can have, then insulin is the next step, or a non-insulin injectable. So diabetes is like a whole other language. So there's lots of different medications that can progress through. But it's certainly not a failure if people are needing to go from good food and moving their body to tablets to a non-insulin injectable to insulin. It's just the progression of diabetes. The pancreas gets a bit tired. It just needs a bit help with that medication intervention. Type 1 diabetes are not making any insulin, so they need insulin immediately
right away. Yeah. So, and what about the gestational diabetes?
So that's a bit of a combination. So a lot of women do an amazing job looking after their gestational diabetes with moving their body and exercise, good food. But some women do need to have some insulin. It's not a failure either. It's just those pesky pregnancy hormones that are so amazing for baby, but the body's just not able to cope with managing that extra glucose in the bloods and getting it into the muscles. So insulin is another management option, or some centres I've worked at might use metformin, which is a tablet that helps with blood glucose levels as well.
Because with the pregnancy, sometimes we might have a pelvic girdle pain, or there could be so many complications that the mothers might not be able to move as much. So so like you said beautifully, that it's not about failing it, but what your body needs to keep going, right? And to look after your body and your bub and everything else.
And I guess like gestational diabetes is very intense management because being pregnant is hard enough as it is for a lot of women, and then having a toddler run, and you've got to be checking your blood levels and perhaps injecting insulin up to 4 times a day. So it is short term, and insulin is better for baby than high blood glucose levels. So yeah, luckily when baby's delivered, the placenta's delivered also, and the pregnancy hormones drop right off. So a lot of women, it stops immediately, but
Yes.
it's super important for women to get screened every couple of years or at their next pregnancy for gestational diabetes as well.
So it's not going to continue what you have, right?
No, because the baby's delivered, the placentas, the amazing hormones are causing that insulin resistance.
Yes.
So it's to get that yucky drink about 6 to 8 weeks after
Yes.
baby's
Yes.
delivered, the placenta's gone, and then that's a test to make sure that it is gone away. Some women might have diabetes or type 2 diabetes following that. So that's it. That's so important for that screening for that gestational diabetes test afterwards.
Okay, so they will have to do the same test that we did, you know, the sweet drink after they deliver the baby.
Yeah, yep, just to make sure it's, yeah, yep.
Yeah.
Yeah.
Yeah. Yeah. Okay. So hello everyone. If you just joined in, welcome. Thank you so much for coming here today. So we have amazing diabetes educator, Mel, here with us. So we are just we have covered what is diabetes and type of gender affected, and the way they are affected with the diabetes and management steps. And now we're going into what is the future looking like for the diabetes community.
So there's lots of amazing things that have happened over since I've been working in diabetes. We're getting a lot of more access to technology for management. We've got the sensors, insulin pumps, there's new medications.
Yes.
It's the fastest growing chronic disease in Australia and globally. It's an impact on the hospital system, on the health system. I think it's about a million hot diabetes related admissions per year to die.
Yeah. Why do you think it is increasing like rapidly?
Is the most common one.
Type 2?
So genetics, type 2. Did I say type 1? Type 2 diabetes.
Yes.
It's the bulk of the work that I do. So we are seeing people developing it because of that genetic component and environmental component as well, that lifestyle component. And we're starting to see a lot of people, if they've got a parent with diabetes, as I said, they're at an increased risk because of that genetics, but we're tending to see people are developing type 2 diabetes a lot earlier than, say, their parents did or their grandparents did. So then we're living a bit longer, we've got more time to have that diabetes impact the body. So we're seeing, a lot more hospital admissions because of the other chronic diseases that can come from diabetes, or the other impacts that it can have on our eyes, our kidneys, our feet and things like that. So it is growing worldwide and in Australia. But in saying that, there's a lot of amazing technology and medication and health professionals around to be able to support people to look after it as best we can to delay those complications and hospital admissions, because the big studies show that those things that we can do really well to look after it.
Yes. So so what are the things that people can do to, I know I didn't, let you know about that, but I'm just curious. So how can people take care to slow down if they get the diabetes, how can they slow down the process of, rapidly increasing?
So the best thing to do is see, obviously I'm not doing a plug, but the more we know, the more we can do to manage. So it's great to get good, reliable information. I know it's scary these days where a lot of people are getting information from TikTok and things like that. So finding those great people that are qualified and know what they're doing and educating it, just to empower people to know what is diabetes. Learning about food is a great thing. So obviously food is medicine, I say. So if we're eating well, moving our bodies well, medication when we need to. Complication screening is really important for people if they're having type 2 diabetes or type 1 diabetes. So that's making sure that our eyes are okay, our heart, our bloods are okay, our feet are okay. So seeing a podiatrist, seeing an eye specialist, and seeing a diabetes doctor if you have type 1 diabetes, or seeing a dietitian if you're needing to learn more about how to look after it. But keeping our blood glucose levels in those safe ranges as best we can, as it's not going to be perfect all the time, and I certainly don't talk to that. If someone's life's hard as it is, and then managing a chronic condition on top can be very stressful and hard as well. So we just aim for the best we can. But I think knowledge is power, and having access. Yeah.
I totally agree to that. And I wanted to ask about as we talked about all the, about that management and all those things, but it'd be great to know what are the resources we have and support in Australia that the people can get the real information, true information from.
So with your healthcare team, so your GP is a wonderful start, or your obstetrician if you've got gestational diabetes, and then some web-based would be Diabetes Australia, the Educator Association, so ADA, NADC. I'm saying all these acronyms now. They're an amazing best practice information provider as well that are in Australia. They have conferences every year, which are amazing. And I would think Baker IDI is another great resource. They cardiac and diabetes related. So JDRF, so the Juvenile Research Diabetes Foundation, is another great resource with regards to type 1 diabetes as well.
Yeah. Amazing. Thank you so much. And maybe if you could send us those resources so I can attach it in the content, and that'd be amazing. And yes, as much as it's a growing issue, people like yourself, they're, trying your best to educate people, and as well as coming up with the new technologies and, all the support. So it is, it sounds positive, as well as the number is growing, hopefully, with the education, like, yourself providing to us is a big, talking and bringing awareness, right? So that's the big step we can do. And hopefully people can apply to that. And then, we can slowly reduce the number.
Yeah, just empowering and educating. There's only about 2,400 diabetes educators in Australia. And if you think about people with diabetes, it's a bit of a workload. But just empowering, educating, and being there to support people when they're ready to have that help.
Yes. So if anyone has any questions to Mel, please comment down below. And while we waiting, Mel, just let us know where people can find you.
So I've just got my little Diabetes Educator Mel page here. I've got www.advocatehealth.qld.com.au, where people can, if they like. And
are you texting now? Are you? I mean, you're putting it down in the comment.
Oh, do you put it in there?
If you want to, if you can, but otherwise it's okay.
Do it like
you just send
my phone up.
No, keep going.
And I'm mobile based as well, so I do some home visits for diabetes education.
Amazing.
And I'm based in as Madrid-Bar. So a few around.
Awesome. So the website, and then you have a mobile service, right? And you're based in Madrid-Bar.
Yep, and Nerang.
Yeah, and Nerang. Okay, awesome. Okay, thank you everyone for being here today, and especially to you, Mel, for your time and effort and all the amazing information you provided us here today. Is an eye-opening, and I think I have this bit. But it would be amazing to learn more from you, but we will have to keep it to next time. So thank you, Mel, for coming here today. You have a great day.
Thank you. Thanks everybody.
Thank you everyone for coming here. Bye. Thank you.